Hello and welcome to Nurses Handbook. Today I will be sharing with you the guidelines of home isolation for COVID-19 patients, which was very recently updated by the Ministry of Family and Health Welfare, and that was on April 28, 2021. As we all know that there is a surge in COVID cases and our country is running into a dire situation of hospital beds running out. So now it is very important to understand that everyone does not require hospitalization. A lot and good care can be given at home also. The very first question that comes in mind is who all are eligible for the COVID-19 home isolation? Person clinically assigned as mild or asymptomatic can be at home isolation. Secondly, the COVID contracted person should have enough space at home so that he may isolate himself from other family members. And if such facility is not available, they can go to COVID care centers set by the government. Thirdly, there should be someone at home who can take care of the person, and the caregiver should be in contact with the hospital. The caregiver should be a healthy person, means he or she should be free of comorbid conditions, especially cardiovascular diseases, as the caregiver and all the close contacts should have to take hydroxychloroquine as prescribed by the medical officer. Now let us see who all are not recommended to stay at home. The very first category is the elderly patients aged more than 60 years, and especially if they have any comorbid conditions like hypertension, diabetes, chronic lung disease, kidney disease, cerebrovascular diseases, etc. are not recommended to be at home isolation. Next category is the immunocompromised people like HIV, cancer, transplant recipient patients, etc. Generally, these two categories are not recommended for home isolation. But yes, they can be at home only and only if the medical officer allows them. Now let us see some instructions which is very essential to be followed by the patient at home isolation. First is to isolate yourself from other household members, especially the elderly and those who have comorbid conditions like hypertension, cardiovascular disease, renal disease, etc. The person should isolate himself in a well-ventilated room and should keep the windows open to allow the fresh air to come in. The person or the patient should always use a triple layer mask and should discard it after 8 hours of use. If the mask gets soiled or wet by sneezing or coughing, it should be discarded at that time itself. Before discarding, the mask should be disinfected with 1% sodium hypochlorite. Always remember to follow the respiratory etiquettes while coughing, sneezing, that is to cover the face. After coughing and sneezing, one should go for a hand washing, etc. One should take adequate rest and drink lots of water to keep themselves well hydrated. Next is always have a thorough hand washing with soap and water at least for 40 seconds. And if not going for hand washing, make use of the alcohol-based sanitizers. Next is do not share your personal items with other people in the household like your handkerchief, utensils, etc. Cleaning of the surfaces should be done with 1% hypochlorite solution like the commonly touched doorknobs, tabletops, almirahs, chairs, etc. One needs to monitor their SpO2 levels with a saturation probe and temperature with a thermometer. If any deterioration is seen, immediately contact the treating medical officer of the hospital. So here we have the patient record that has to be maintained either by the caregiver or by the patient himself. Every 4 hourly, one needs to check the saturation and temperature and heart rate, and also check for the wellness of oneself and assess for breathing also. These are the instructions that the patient needs to take care of. Now let us see some instructions which the caregiver needs to follow. The caregiver should always wear a triple layered mask or they can even wear an N95 mask if they are with the patient in the same room. One thing to be remembered is while sleeping, both the caregiver as well as the patients should not be using the mask as it can cause discomfort to both. The mask should be discarded after 8 hours of use or even before that if it gets contaminated. The front portion of the mask should not be touched, and if touched, thorough hand washing should be done. One should not touch their own face, nose or mouth. Now let us see some instructions regarding the hand hygiene that needs to be followed. Always use soap and water to wash your hands at least for 40 seconds, and if hand washing is not done, make use of alcohol-based sanitizer to clean your hands. Before and after cooking and before and after eating, one should go for a hand hygiene. After using the toilet, after coming in contact with the patient's surrounding or patient, one should be having a hand hygiene. Before and after the use of gloves, one should be going for a thorough hand washing. After the hand washing, one should use a tissue paper or disposable towel for hand drying. And if not available, make use of a normal towel available at home, but make sure that the towel is not shared with any other members in the family. Now let us see what all are the steps that needs to be taken when we are coming in contact with the patient's environment. Avoid direct contact with the body fluids of the patient like blood, urine, saliva, etc. Always wear gloves while entering patient's room. Do not share the patient's contaminated items like sharing food in same plates and cups, etc. Provide the food in patient's room itself. It is preferred to use disposable plates, and if not, the utensils should be washed thoroughly with soap and water, and the caregiver should use gloves while cleaning the utensils. So these were the instructions that has to be followed by the caregiver. Now let us see how the waste to be discarded. Effective waste disposal shall be ensured so as to prevent further spread of infection within household. The COVID patient's waste should be discarded in a double cover polythene, and before discarding the waste, bag should be disinfected by 1% hypochlorite solution or with Dettol spray disinfectant. And these are the guidelines of the Central Pollution Control Board. Now let us see the treatment part that has to be carried out at the home isolation. First important thing, even if you are at home isolation, you should be in contact with the treating medical officer and hospital. Symptomatic treatment should be taken. That is, for fever, one may have paracetamol tablet, that is 650 mg 4 times a day. For running nose and cough, get the prescription from the doctor and take the medications accordingly. If the fever is not coming in control, consult the doctor as he may prescribe you some NSAIDs like naproxen. Even the doctor may consider the patient to take tab ivermectin for 3 to 5 days. Continue other medications like the medicines you take for diabetes, hypertension, etc., but only after the consultation with the doctor. One must also take warm water gargles and steam inhalation at least twice a day, as it will help in soothing your symptoms. Budesonide puffs may be taken twice daily for 5 to 7 days if symptoms like fever and cough persist beyond 5 days of onset. The decision to start injection remdesivir will only be taken by the doctor, and it should be administered in a hospital setting only. IV steroids are not recommended in mild cases of COVID-19, but if the symptoms persist beyond 7 days, consult the doctor as he may start with some low-dose oral steroids. If a patient at home isolation has shortness of breath or oxygen saturation is falling, then immediately consult the doctor or hospital as such patient requires immediate hospital admission. Now let us see when one requires to seek the medical attention immediately. If a person is having shortness of breath or difficulty in breathing, If there is pain or pressure in the chest, then they should be seeking the medical attention. If there is a fall in the oxygen saturation, that is, if saturation falls below 94%, then one should be seeking for the medical attention. Lastly, if the patient have mental confusion or inability to arouse, then one need to seek the medical attention immediately. Now let us say when to discontinue home isolation. After at least 10 days have passed from the onset of symptoms, and if the patient is not having fever from 3 days, then they can discontinue home isolation. And according to the guidelines of Ministry of Health and Family Welfare, there is no need of testing if home isolation period is over. Thank you for watching, and for more updates, please like, share and subscribe to our channel, that is Nurses Handbook.